Introducing Dr. Stacy Loeb from New York University. Thanks very much.
Thank you so much. It's truly an honor to be back at this meeting, which is absolutely the most high quality. I'm here to talk about patient-centered reports, and also since many in the audience are nuclear medicine or radiology, perhaps to share a few thoughts on reporting also as your friendly referring urologist, and what would be very helpful. And so this is just a little bit of background why we care about patient-centered reports. Obviously, the patient should be at the center of everything, and when it comes to prostate cancer, shared decision-making is really central at every stage of the disease process. And so effective patient-centered communication is really critical for informed decision-making. The trouble is that many of the documents and tests that we're using to inform these discussions, like pathology reports, imaging reports, are really written for doctors using jargon, whereas lay health information is really supposed to be communicated at a 6th to 8th grade reading level. And so this really comes to be at the forefront, particularly in locales such as United States, Canada, where there are actual mandates for patients to immediately receive access to their lab reports. And this interesting study from 2022 in the US found that among patients with cancer, 75% of their results were viewed by the patient before their doctor even saw them. So you can imagine what kind of anxiety this can cause receiving these very technical documents that your doctor hasn't even seen. And this has the potential for downstream harm. As a result, many groups have started to work on patient-centered reports. For example, this was a very nice study where they developed a patient-centered prostate biopsy report. And so you can see the report on the right, but the key parts are: why did we do the biopsy? What does it show? And this is all in lay language based on looking at your cells under the microscope. There is cancer. How much cancer? 8 of the 12 samples had cancer. How bad is it? The grade tells us how aggressive, with an explanation of the grade. What is the risk to my life? And some tables describing how we determine this. And then, was there anything else that the patient needs to know? So this was actually tested in a randomized trial where patients either received just the standard pathology report or the standard report with the patient-centered report. And not surprisingly, the patients who received the patient-centered report were better able to recall their Gleason score, the number of positive cores, and the vast majority thought that this should always be included. Patient-centered reports have also been designed for some imaging, including MRI. And so this is an example of a patient-centered MRI report from Perlis and colleagues. And you can see it's really concise language. There's visualizations. You can see exactly where the findings are located, but also the sense of urgency. Like here, there's a low chance of cancer. So not to get somebody overly concerned when we don't have a high level of suspicion. And then importantly, what do you do next? So you should meet with your doctor. Here's the phone number if you don't already have an appointment. Another important component that they included is a glossary. Many patients would have trouble understanding the jargon that is used in these reports, which itself can lead to misunderstanding and significant anxiety. You know, even things like lymphadenopathy, reactive lymph nodes. What does that even mean? Does that mean it's in my lymph nodes? And so just defining these terms is just so important. Now, what about PSMA PET? Obviously, that's been a major topic at this meeting, and it's exploding. This was just a recent paper from nationwide data from the US veterans hospitals, and you could just see amazing. I mean, for high-risk disease, literally from 0 to about 70% in just a 3-year period. So really important that we focus on these reports. But now we have this added problem because you have this whole body imaging, and there's so much stuff that is on there all over the body. And look at these words. I mean, Radio tracer avid, a tracer avid soft tissue nodule on the skin surface, pleural thickening, hernia, degenerative changes. I mean, can you imagine someone opening their phone and reading this report? And by the way, the reading level is 16, so we're really, nowhere even close to the 6th to 8th grade that you would want for something that a patient is viewing. So what are the patients going to do? Many will go to Google, now maybe ChatGPT, and say, here's my report, what does it mean? And so that luckily, this nice study actually looked at that. So they fed 164 de-identified reports from PSMA PET into ChatGPT to see, how good a job does it do summarizing. So the good news is that actually most of the time is pretty accurate. And so a nuclear medicine physician and a radiologist rated ChatGPT's summaries. And, out of 5 points, it did pretty well. The bad news is that 8% of the time it had harmful information where it actually fabricated that the person had metastasis and they didn't. So that's about as devastating as you could get. So I think we don't really want our patients going to these platforms. So I think the key really then is that we try to design more patient-centered PSMA reports. And so we started to do this, and I'd like to thank Ken, Stefano, Alberto Vargas, who you heard this morning, and the other people on the panel who responded to our survey. But one of the first steps is to figure out from experts what are the most important elements that need to be included in the report. So if you're really parsimonious, because there's just so many extra words there that maybe aren't so critical for the patient. And so in our survey, the experts felt that the location, the estimated level of suspicion, and comparison to prior studies, if available, were the very most important things if you had to pick what goes in. Another thing we asked was for some suggestions for a glossary and how to actually provide more patient-friendly descriptors for some of these otherwise very scary terms you might see, like PSMA avidity. How about just like hotspot or spot that lights up? So, I think we really can do better. Now, there are some other challenges with PSMA PET reports. So Alberto Vargas and I had fun with this little project where we took all of the consecutive PSMA PET reports that were referred to NYU last year. And so these were all done at other hospitals across the United States. So total 42 different centers performed these tests, and we reviewed the reports to see how well is the reporting being done just kind of in the real world. Now, obviously, this is not like a representative sample because these are people who were referred to our institution, so these are US-based. But anyway, there's substantial heterogeneity. Very few used any kind of standardized framework. The minority even reported longitudinal assessment of all the lesions. And then another big problem is the amount of incidental findings. So 89% had incidental findings with a median of 4 per patient, but the range was up to 17. So can you imagine, like 17 other findings, but only 17% of them provided any follow-up recommendations. So this is really hard for someone like me as a urologist. So these were the incidental findings that were reported, and you can see the arrows. I mean, they're literally from the person's head to their toes. I mean, there was no part of the body that was left uncovered. And, I'm getting this report. I mean, what do I do with all this stuff? I mean, if they have kidney stones or hydro, I mean, thank God I'm a urologist, but some of these other things, like 2 people had a brain infarct, imagine getting this result back that you got for your prostate cancer and it says brain infarct. So this is, yeah. So without any kind of guidance, how concerned should we be? What is the next step in imaging? Am I going to get 17 different consults for this patient to find out what all these things are if we care? I mean, I haven't studied thyroid nodules in 15 years. I don't know if this thing matters. So bottom line, pathology and radiology reports are written for physicians. They have a lot of complex jargon. Patient-centered reports give an opportunity to really increase the understandability and actionability of results to support shared decision-making. And overall, just greater standardization of reporting is really important for optimal care. Thank you.